Hello, I'm Catherine Ellison, and today we're talking with Nerissa Bauer from Carmel, Indiana. She's a developmental pediatrician and an ADHD educator. Also, the mother of two teenagers, a blogger, owner of two businesses. This sounds like an ADHD typical situation here.
Yes.
I'm just curious, when were you diagnosed, and can you tell us about what led to that?
Yeah, I'd be happy to. I was recently diagnosed 3 years ago at the age of 47. I was drawn to working with families with ADHD, and through the course of my own journey, it wasn't until I left academia and burned out of academia that structure, the routine, the meetings, all of those things went away. It highlighted my day-to-day struggle to get out the door. I was so excited to be my own boss and set up my private practice. I was struggling with paying bills and finding my keys. It wasn't until I put two and two together and my son was diagnosed, I was starting to think about this and I was like, huh, I wonder.
That is fascinating. So you were diagnosed at 47. You're a developmental pediatrician. So you put two and two together. A lot of parents do that when they see their child go through the questions and they answer the questions. Was that the spark that got you there?
Yeah, I didn't realize that I had been able to engineer my life to help me thrive when those supports or that scaffolding of the day-to-day grind of academia where there's meetings, structure, and it goes away. I didn't realize how much I depended on it.
That's fascinating. A lot of people who diagnose ADHD will insist that you had to have had problems growing up. That didn't happen with you?
In retrospect, when I was getting tested by a psychologist, we culled through all those memories. I was a good student. I would tell you, though, my internal experience never matched the external. I always felt like I had to work much harder to just keep up with my peers. My sister graduated valedictorian, and I never felt she had to work as hard as I did. I was studying all the time. I was terrified that I would forget something or not know what I was supposed to be doing. Record lectures, highlight them, study all the time. The amount of work I was doing was exhausting just to get to where other people were.
That's such a common story for girls, not
Yes,
necessarily for boys who are acting out, getting caught, getting
yes.
diagnosed. A lot of girls end up with anxiety around that or depression. Were those issues for you as well?
Not diagnosed and treated, there's always that nagging voice in your head. I'm not good enough. I can't do this. Why am I the one that has to be spending all this time and nobody else seems to have to work as hard as I do, right? We're questioning ourselves, we're doubting our abilities. This is a true issue when it comes to girls and women. What we're learning is that ADHD does not mean that you are not smart and capable. But girls and women mask things. We figure out what we can do to stay afloat, that scaffolding that comes implicit in the job description, like going in academia, that's how they function in that world. But once I left, I had none of that. I didn't realize how critical that was to my day-to-day functioning.
What made your decision to leave? What inspired that?
To leave academia, I got really burned out doing what I was doing. I was in charge of clinical teaching, running my own patient panel, doing research, the grind day in and day out. I would show up to work and I wasn't happy anymore. People know me as the person always smiling. It took so much effort just to smile. So I just realized I was burnt out. Something needed to change.
Also, your kids at that age generally take a lot of time, especially if you have two with ADHD.
Thank you for mentioning that because I remember quite acutely that we were getting ready to go on vacation and my kids kept saying, Mom, you're not bringing your laptop with you, are you? I always felt like I had to do more. I was always working. I couldn't ever turn off. When I heard that from them, it made me pause and think, they're going to be grown here before I know it. I need to prioritize my time and figure out why I have this constant need to be working at all times.
For me, it's a sense of control. With kids, there's nothing you can control, but with work, it's circumscribed. You know what you have to do. There's a great relief in that. Kids, for a mom with ADHD, it's just this overwhelming amount of things that you could do and choices and unexpected crises to do.
When one thing goes awry, it's, oh my gosh, the rest of the day
Right.
is done. So,
Yeah, it's a job in itself for sure. You're still doing so much. Do you have tricks keeping yourself organized with all the different things you're doing?
oh, it's a work in progress. I'm
Mhm.
a first to admit. Yeah, when I tell people I have ADHD, a lot of them are like, whoa, really? You do? I can't believe that. But I tell them teasingly, if you can see on either side of this, you would not question that. One little window here. In all seriousness, I have learned that I cannot do it all. This is knowing where my strengths are and asking for help, right? I have an executive assistant who is basically another part of my brain. She keeps me on track and organized and reminds me of things that need to be done. I have a bookkeeper, so I don't have to learn QuickBooks to do my business. I've learned to rely on other people whose strengths are not mine and not beat myself up over it.
Are you taking medication?
I finally got on medication, found the right medicine. I'm also working on sleeping. I don't always do that. Sleep is an elusive thing for me sometimes, but when I get good sleep, it helps make my brain work better. So always trying to work on that. And regular is so important. Getting outside. I just moved to a new space for my office. I have all these windows. Having sunlight helps improve and boost your mood. Those things for myself has been important in helping me manage my own ADHD too.
Yeah, I think once you start caring for a child with ADHD, you realize that you can also care for yourself, right? You give yourself a little bit more permission.
Yes. What is hard though, parents will want to always put their children first, but we have this conversation. It's really important that we take the time to care for ourselves. We cannot give them the 110% we want to give them if we're running on empty. It's a
Right.
truth.
Dr. Bauer, can you tell us about what you're doing professionally to help parents with kids with ADHD?
Of course, I have my own private practice. I see kids 2 through 18, 19. I make the diagnosis of ADHD as well as other coexisting conditions like anxiety, depression. I help families create a care plan. I do a lot of education about that because I find parents come to me usually after working with a pediatrician or other specialists. There is an amount of worry or anxiety. Can we fix this? We cannot, something has to change. Parents are dreading or worried about the ultimate diagnosis. What does that mean? Do we have to start medicine? All of these questions come up. My job is helping to educate families, everybody in the room, on what is a care plan, what goes into treatment. It's not just medicine because pills don't teach skills. A huge part of what I do is make sure that kids and parents on board together, we're on the same page. In addition to seeing them and treating them in my practice, I have my own podcast, I have a community, and I developed a courses called Teach Me ADHD, which is for kids 8 to 12, where they learn about ADHD. It's taken with their parents and with other families. We become detectives, and without judgment or shame, we learn what ADHD is, how it shows up, help empower parents and kids, giving them the language around the care plan and starting to build these skills and the self-awareness on how to work with their brains.
That's great. Do you differentiate at all between sons and daughters?
Yes, yes. Even in that first class, we talk in an interactive way. We break down ADHD. I'll tell them attention deficit hyperactivity disorder. It's a terrible name. Okay. What have you heard about what does inattention mean? I ask them for clues. What does that mean? If you don't know, ask your senior detective. As a group, brainstorming that. Then we talk about what have you heard about this word impulsivity? What does that mean to you? And then we talk about hyperactivity. What does that mean? Then I'll throw in my thoughts. As a doctor, I sometimes hear words like can't sit still, doing this, doing that. And I say, what do you think? Have you heard about that for you? And the kids are like, yeah. And then together we talk about how those things happen, but it can present differently in different people. So let's think about that. Now that you know what those individual words mean, what have you heard about it happening in your life? What do you think? What kind of ADHD do you think you have? Because we know everybody has different parts of this. Then we start that conversation. We introduce a topic, we have them self-reflect, we brainstorm and talk about it. That's the model within the class.
In the years since you went to school, there's been more awareness that girls also have ADHD. I'm
Yes.
wondering how much has changed when you look at the girls and the boys. What are the attitudes that persist or don't?
Yeah, that's such a great question. There's still a lot that we're learning about ADHD even to this day. I've been a physician since 2000, and we're still learning new things about this field. There's always more to learn. People may have a misconception that it's just boys who can't sit still, they're rambunctious, they're running across the street, getting in trouble, getting suspended. One of the things we need to educate families and the community about is the different presentations. Like me, where I went through med school most of my adult life not knowing I had ADHD. When I sat down and took inventory of all the things that I was struggling with and why, it started making sense. To somebody who doesn't have that knowledge, they get that feedback from the environment. Why can't you do this? Why are you not doing that? That inner narrative or that story, we start telling ourselves about it. We can mask and we feel bad, and anxiety and depression pop up. All of these things happen, especially for girls. We have to bring greater awareness that girls can slip under the radar. We see a second prevalence peak of ADHD diagnosis, not just in the early 3 to 5 year range because they're disruptive and impulsive and hyperactive, but come fourth, fifth, sixth grade, it's not that girls are learning to read, they're reading to learn. That's a very different skill set. That working memory and the ability to recall information. And as that working memory is not working as well, it gets harder and harder to apply. Girls, too, I'm seeing since COVID a real big spike of anxiety and depression. We know that ADHD and anxiety, they're best friends, they run together. Sometimes it's the anxiety that brings them to me first. Sometimes it's, I don't know what's wrong with me. I feel like I can't pay attention. I'm zoning out in class. I'm missing things. Sometimes it's the attentional piece. But regardless of how they got here, it's important that we look at the whole big picture.
Do girls and boys react differently when they're diagnosed with ADHD? Is there more shame from girls?
I can't say that there's more shame, but there's much more of relief for some of the females that I've seen, especially the older kids, like middle school, high school, college age. When I finally tell them that this is what's happening, I see, oh my gosh, thank goodness. I'm so glad that somebody is listening to me because I have felt this way, and being told, no, it's fine, you're okay, you're a high achiever, you can't have ADHD. They feel that validation. You can see that relief on their
Yeah,
face.
yeah, yeah. Do you see that girls are still trying harder than everybody else? Yeah, you see that too.
Yes, hear all those stories, and it's exhausting. I hear the exhaustion. I am so tired of having to pretend that I can do it all and staying up late and not sleeping well, but trying to smile. I hear all of that.
What age do you think it's ideal to have a diagnosis?
Oh, the earlier the better. As a behavioral pediatrician, I have made the diagnosis in kids as young as 3, 4, 5. The other day, I had a college student. She's grappled with anxiety and depression, but we've made the diagnosis of ADHD. She was in college already, a first year college student. It still meant so much to her to have that. For me at 47, I grieved, I cried, even though I know it's not a bad thing, but to finally have the answer and things clicking and making sense, I had to grieve because it was time lost.
Yeah. If you imagine your life having been diagnosed as a
Much
child,
earlier.
how do you think it would have been different?
Yeah, it would have led to less of that nagging voice in my head. What's wrong with you? Or I would have been able to find the right medicine sooner and just helped my brain work much more efficiently and learn to work with it.
Yeah.
So I was grieving for my younger self who kept questioning and kept wondering what's wrong with me. I wish for girls, for anybody who's feeling this way, if it is ADHD, to get the right diagnosis and as early as possible. It can really change trajectory of someone's life.
That's so true. There's more ability to even to be happy, to let yourself relax. So Nerissa, often when ADHD runs in families so strongly, I'm wondering how you react when you see a parent who you can tell also has ADHD. Do you mention it or?
Part of the intake process, when I'm meeting families for the first time, I have the luxury of 90 minutes to hear their story. But part of that process is getting a good family history. I tell parents all the time, these things tend to run in families. I'm going to be asking you some questions. I want you to think about yourselves, your brothers, sisters, parents, and grandparents. We're just going to take inventory for now. I tell them because ADHD, there's not a blood test or an imaging study to make the diagnosis. We've got to look at trends and get the history. I set the stage. We go through anybody with ADHD, anybody with anxiety, depression, anything like this. It starts the wheels turning, correct? As we go through the process of the diagnosis for the child, educating the family on what ADHD is and bringing them on board, like how do we start working on this and how do we support this? As parents start finding out more and more about what ADHD truly is, many of them say, "Oh my gosh,
Like
what
you
can I
did.
do? Can you help me?" I'm like, yes, we actually can. Sometimes, just like with kids, you have to meet them where they are. Parents may have misconceptions themselves or not believe ADHD is a thing. It's just he's a kid. In that first meeting, I'm listening, I'm observing, I'm trying to figure out where each parent and the child is in terms of their understanding of what's happening. Then backfilling in the holes once we have that relationship and that trust in who I am, that information that I provide, it's much better to have that come in doses and insight into, because we know that the changes happen and is greatest when there's buy-in and understanding. We don't want to just say, you have ADHD, you should get, tested, but slowly building that awareness, that conversation. Many times parents are like, wow, I've been doing more reading. I've been thinking about what you said. I might have ADHD. Can I get tested too? I'm like, absolutely. Yes. What I offer in my clinic is what we call objective testing for ADHD. It's a computerized test, an FDA approved test for people 6 to 60. It's super boring. It's meant to be boring because people with ADHD struggle when things are boring, monotonous, and non-preferred. This is the one way we can capture objective data on how you're moving, how impulsive are you, how good are you at paying attention during this task. Then we look at this report together. I couple my consultation, not just the good old-fashioned history, collecting parent-teacher rating scales, interviewing the child, observing, but also with objective data, which I found to really increase the ability to bring families on board, especially for girls and women who maybe are anxious and have perfectionist tendencies, where when you ask teachers, they're like, oh, they're a star student. No, they don't have ADHD. But that doesn't explain how she's feeling. The objective tests bring that out. It changes the playing field. Here is the evidence, and it's validating for them.
It's so interesting what you say about teachers. I really would have thought that by now they wouldn't just say, oh, she's a star student, that the teachers would be more trained to notice when a child has that interior struggle.
It's really hard, especially girls who mask it and they are high achieving, they want to do well, they may be like drifting up, but then they're able to smile and catch up, right? They can mask it, but the inner feeling of, gosh, I'm distracted. What did they just say? I didn't catch that. I don't want to ask. Yeah, it's a game changer. When I started doing objective testing and augmenting what I already do, parents see data that is clear, even for the child or the teen. Wow, that helps me understand what's happening.
In how many of the cases do you find yourself prescribing medication? Are there people who just cannot be helped by medication?
Medication is the first line recommended treatment as prescribed by the American Academy of Pediatrics. It's the first line treatment for school-age children and up, right? For preschoolers, it's not the first line, but it can be used after parent management training. There's stigma about medications. It works, but it needs to be applied by someone knowledgeable about these medications, what to look for, and guide parents in the process. Oftentimes, parents are scared about it or heard horror stories about kids being zombies or losing weight. My job is to help educate. I never force anybody to doing something that they're not ready to do. It's my job to help educate them about the role that medications can play when they're ready. I prescribe a lot of medicine. As a doctor, parents are like, you're a doctor, you can prescribe me medicine. But I am also one that says pills don't teach skills. I tell kids medicine is like gas for a car. Okay. Putting gas in a car doesn't make the car go. You need the driver. That's you, right? You can't get into a car and it has no gas and expect it to go anywhere, right? Having medicine on board is important, but it's not the be all end all. When they take a medicine, it's helping their brain work more optimally, but ultimately it's their choice, their decisions day to day of what they're doing. and navigating through life.
That's a great point. So you think that medication works for everybody?
Medicine is oftentimes the first line and probably the thing that can help quickly if it's the right one. I'm going to qualify that, if it's the right one. There are a lot of FDA-approved medications. Unfortunately, about 10 to 12% of people will not tolerate the first-line recommended treatment, which are stimulant medications. They just will not tolerate it for side effects. Then we have a second class of medications called non-stimulants. And if there's comorbidities like anxiety, depression, all these other things, it's now ADHD plus. It can make it hard to figure out that medication piece or the medicines. First, you have to get buy-in from everybody, a realistic expectation that there is a little element of trial and error. But that's why the diagnosis is so important. Rather than just throwing a medicine on board before we truly know what it is we're treating, that's a disservice, right? If I know that a child has both ADHD and anxiety, I'm going to be more leery of just doing ADHD medicine. Sometimes that can amplify anxiety, right? We have to talk through all the different possibilities of various medicines and different treatments when crafting the plan for the child.
Sure.
When a diagnosis is made, one of the things that I often will talk with families is, now what? Parents sometimes are terrified by whether or not we're going to talk medicine. Yes, medicine is on board. We need to talk about medicine. Medicine is one part of the care plan. The other part is skill building. ADHD is an executive functioning issue, and people with ADHD have lagging skills in this. You can teach them these things, but you've got to have an opportunity to teach them, whether that comes in the form of therapy or coaching. Parent support. What do parents need to know? How do we help them understand their role in providing scaffolding for that child so that we can meet them where they are and build those skills? Because outside of therapy or coaching, it's parents, right? We have to lend our own executive functioning to the child. Their brains are still developing until mid-20s. What kind of parenting support does the parent need to understand and work with their child's ADHD? And school supports. If we're starting to see it affect learning, do we need an IEP, a 504? Who else is on the team that sees your child day to day that we can bring on board? Looking for learning disabilities that are affecting how that child processes information. Lastly, but most importantly, self-care strategies. The importance of sleep, nutrition, physical activity, screen time moderation. Anybody with or without ADHD need to be doing to optimize how their brain is working. I like to tell parents that these are all 5 pillars of the care plan that we need to be talking about and monitoring at each and every visit. How are we doing in all of these areas? As the child's brain matures, as expectations get harder, where are we in this process? Reevaluating all of those things at any point in time. That's where tailoring the treatment plan is so important. That's why I really love the opportunity to talk to you today, because I want to broaden families' understanding that ADHD diagnosis doesn't necessarily only mean medicine or only mean therapy. It means all of these things.
That's a really good point.
I've gotten to do the Teach Me ADHD class with families from 19 different states in Canada. They found videos that I produced about the class and testimonials. I'm excited to have a space to help as many families with identification of ADHD, management, understanding, and acceptance to break down the stigma and get people talking.
Nerissa, will a parent come to you with a child and they don't have ADHD, but the parent thinks they do?
That does happen, but something that we monitor. I want to honor what they're feeling and experiencing, but everybody's brain is still developing into mid-20s. Some of this could be within normal or expected for that age. Some kids have shorter attention spans. Some kids are having a harder time. Part is hearing parents' concerns, helping them understand what it is or what it isn't, and then developing what we can do to support you. There is a reason you came to me, so let's tackle that. The labels don't matter. It's how your child is doing. All parents want to do the best they can by their child.
One question I should have asked before is, in your practice, what is the ratio of boys to girls?
What's interesting, I was looking at that the other day, and it's actually 50-50 almost. It's almost 50-50. It's not necessarily one gender more than the other.
That's encouraging, because maybe awareness is catching up with girls.
We believe all girls with ADHD should get a fair start in life by getting diagnosed by age 8. Visit us at www.FINDtheADHDgirls.org. Thank you.